but I'm obviously not participating in the happy hour part. Oh, that was awesome.
There might be a little bit more.
Here, mostly on the right side.
Okay.
There's a lot of stiffness, and I do, when I'm on the traction table, I feel it the most down here too.
Okay.
But it's still in this main spot here.
I'll take your glasses here.
Into that.
Okay. And let's have you lay down here and yeah, just we've wiped everything down between patients and stuff. So.
Thank
Is
you.
it the right side or left side that hurts the most then?
It's the right that's the most. The whole
Okay.
lower back is stiff, but the hip portion of it, the right's the most.
Motion here. Okay, so we got right leg short and bring it up. It gets pretty even here, but you can also tell, you know, if I push this up, this side doesn't go as far. So we have an issue on this right side. Oh, that was good. Okay. That was good too. Yeah, right down there, huh?
Yep, that's it.
Yeah, I can feel that. Let's lay this side up here, facing me. Got big plans of staying in this weekend.
Oh yeah, staying in for sure.
Yeah.
We're actually doing a video happy hour with my cousins, but I'm obviously not participating in the happy hour part. Oh, that was awesome.
There might be a little bit more there. I can come over the way. You're the. You could be the DD. I guess well, if it's video, I guess you can't do it. Yeah. I remember when my wife was having kids. She was always the DD. Okay.
Oh, that one was the
That
pop
was
too.
good. Yeah. She used to get upset every time I said she was DD. That's heavy. Okay. Look to the left. There we go. Okay, let's have you lay back face down. We're gonna double check that. Feel alright?
That felt great.
Alright. So you can see moving a lot closer. It's a lot better than what it was. Let's see. Legs are looking good. Looking good here too. Alright. You're all set, so let's come up then.